my name's Carly, and I'll be your student physical therapist today. Can you please confirm your name and your age?
My name's Linda. I'm 75 years young.
Linda, so what brings you in today?
It's just kind of my feet. They're kind of feeling like they're falling asleep a little. It's kind of a weird, like tingly feeling on both of my feet.
Oh, that doesn't sound too fun. I'm sorry you've been going through that.
No, not at all. And it's just, I really love to go to the beach, and I love the feeling of like sand between your toes and walking on the sand and the shells and the water. I feel like I don't feel that as much, and sometimes there's like a burning.
Okay. Has there been any numbness, or like if you can't do you feel like you can't feel it?
I guess it would be more numbness. I just can't feel the sand too much, and I wear sandals all the time, and I'll get shells in there, and I don't really notice until I take them off. It's just kind of odd.
Okay, definitely something I can help you out with. Tell me, is the pain, does it come and go? Is it constant?
It comes and goes. Sometimes I just don't even notice it when I'm not really paying attention. When I'm at the beach, I feel it, and sometimes it wakes me up at night, kind of like a burning sensation too.
Right. Is it what would you say makes it worse?
I wouldn't say anything really makes it worse. It's just kind of random.
Okay, so it just happens. It doesn't matter what you're doing.
Yeah.
Okay. Is there anything that makes it better?
I've tried ice and Aleve and heat and whatnot. It really doesn't help. Sometimes a few drinks will make me forget about it though, but that's really about it. I don't think it really helps. I don't pay attention to it.
Okay. Are you a frequent drinker?
I wouldn't say frequent. I'm definitely not an alcoholic, but I'm retired. I enjoy 1 to 3 glasses of wine when I get the chance. Out on my balcony, we have a beach condo.
Oh, that sounds beautiful.
Yeah. Beautiful to watch the sunset every night.
I'm very jealous. That's my favorite place. Do you have any history of smoking, or do you currently smoke?
I smoked a while back when it was cool and they still thought it was okay for you. But I stopped a while ago.
And going back to your pain, so currently on a scale from 0 to 10, 0 being nothing, 10 being I need to go to the emergency room, what would you say your pain is?
Right now it's not really noticeable, maybe like a 2 out of 10.
Right. And that same burning, tingling?
Yeah, it's just kind of like ant crawling. Just a weird, it's just not like pain, it's just like unpleasant. I just don't like the feeling.
Yeah, it doesn't sound too fun. What would you say the worst has been in the past 24 hours? Same scale.
I would say it can get up to like a 6 out of 10. When it wakes me up at night, it's kind of like burning. It's just really, really aggravating.
And that pain that's waking you up, it's only in your feet?
Yeah, in my toes and my feet.
Okay. On the bottom and the top?
Primarily the bottom, but I feel like it's kind of starting to maybe be the top too.
Okay.
Just can't tell.
Okay, definitely something we can look at. And so would you say you've noticed a difference in your walking or your balance at all?
No, not really. I've always had kind of poor balance. I've always had to make sure I'm paying attention when walking on the beach. So I don't think it's really changed too much.
And when would you say this all started?
It's definitely been a while ago, probably. And when I look back, probably a few months. Okay, 2-3 months. It's just kind of getting worse, and now I'm just kind of annoyed with it. So I figured I might as well do something about it.
Okay. And do you remember an exact instance or experience that it started, or it just
kind of happened? Okay, I didn't injure myself. I don't really ever fall either, so I've been of that sort.
Okay. And did it start in a specific area, or?
Yeah, it definitely started on kind of the bottom of my toes, maybe, and then just kind of became the whole bottom of the foot. And like I said, I feel like it might start being the top of my foot. I can kind of feel that.
Okay. And do you have any other medical history I should know about, cancer, hypertension, heart disease, diabetes?
Yeah, a while ago I got diagnosed with hypertension and diabetes because I wasn't really taking care of myself. But now I'm taking better care of myself. So, I mean, I still have those things, but not really medically managed or anything.
How long have you had diabetes for?
It's been about 20 years. It's been a long, long time ago when I wasn't taking care of myself. Yeah.
And you're not on any diabetes medication for insulin or anything?
No.
Okay. And just a couple more questions I have just to make sure that you are appropriate for physical therapy. Any recent weight loss or weight gain that was unexpected?
No, I'm pretty normal weight, so I try to keep it like this.
Good. And any fevers, recent infections, chills, or night sweats?
No, nothing like that.
Any bowel or bladder dysfunction?
Oh, no.
Okay, good. And any recent nausea or vomiting?
Maybe after maybe a few drinks.
Get all of us.
Nothing unexplained.
And besides the pain that's waking you up at night in your feet, any unexplained unrelentless night pain?
No.
Okay, well, Linda, that concludes our subjective examination. So now we're going to get to do some tests and measures. So what you just saw is a typical subjective presentation of individuals with early stages of diabetic neuropathy. And the epidemiology is 50% of adult diabetics, and there's a higher prevalence in type 2 versus type 1 diabetes. It's going to be more prevalent in older age with individuals of a longer duration of diabetes diagnosis, like you saw with Linda, who had it for 20 years. Risk factors include heart disease, high BMI, dyslipidemia, high triglyceride levels, past history of smoking, hypertension, alcohol consumption, and the patient will describe feelings of tingling, burning, numbness, stabbing sensation, and it's going to start in their toes and gradually progress through their feet over time, eventually leading to a glove and stocking distribution. They'll have hyperesthesia in the plantar aspect of the foot, and the later stages of someone with diabetic neuropathy might present with foot ulcers, but in this case, it's an early presentation. And the pain can work its up all the way up to the calves. All right, now we're going to move on to the objective portion of your evaluation. So I'm just going to do a quick overall muscle screening of you. I know you said that you're pretty active, so I don't expect to see anything abnormal, but we're just going to see. So do you mind just putting your hands on the side for me? And can you lift up this leg for me? Don't let me push you down. Good, very strong. Lift this leg up for me. Don't let me push you down. Very strong. And can you kick this leg out for me? Don't let me push you down. Good, very strong. All right, kick this leg out. Don't let me push you down. Very strong. Now bring your leg out. And try to pull me in doing the leg curl. Good. Same thing on this side. Try to pull me in. Good. And can you push your toes up to my hands? Don't let me push you down. And just your big toe. Don't let me push you down. Okay. So she has a normal manual muscle test for just general overall. So next I'm going to test dermatomes. So I want you to close your eyes, and basically what I'm going to be testing is your sensation. I know you said that you feel like you've lost a little bit. So I want you to tell me, I'm going to touch your legs, and I want you to tell me if one side feels the same as the other. Okay? So close your eyes. Does this feel the same as this? Does this feel the same as this?
Mm-hmm.
Does this feel the same as this? Does this feel the same as this? Does this feel the same as this? Does this feel the same as this?
Mm-hmm.
Yeah. Do you want to do that one again?
Yeah.
Does this feel the same as this?
Yeah.
Did you feel it?
Mm-hmm.
Does this feel the same as this? Does this feel the same as this?
What?
Let me do it again.
Yeah.
Does this feel the same as this?
Yeah, it just feels different.
From the ones I did up top?
Yeah.
Is it like How is it different?
I don't really feel you out as much.
Does this feel the same as this?
Can you do it again?
Does this feel the same as this?
Yeah.
It's okay.
It's like muted.
Okay. It's okay, don't worry. All right, so next I will test the patient's reflex, but so dermatomes, you will see a decreased feeling of sensation. Typically, it's going to be the same bilaterally, like it was for Linda here. But as she got down lower to the feet, she had decreased sensation. She couldn't really feel what I was touching. Now I'm going to do reflexes. So I'm going to do patella. That's normal. Normal, and then I'm going to do Achilles. So her Achilles reflexes are diminished, and that's something you will see in diabetic neuropathy patients. You can either see diminished or absence. Since this is an early catch of the diagnosis, it's more diminished. So now I'm going to have you lie on your back. And I'm going to perform the monofilament test with my monofilament. So basically what I'm going to be doing is I have this little tool called monofilament, and I'm just going to be poking your bottom of your foot. So it's just going to feel like that. It's not going to hurt. It's not going to be a needle or anything. It's just a nice little light touch. And what I want you telling me is every time I hit it, I want you telling me yes if you feel it. Okay. Okay?
Started.
Yeah, I did.
I don't know how anyone's supposed to feel a little piece of floss.
Yeah, it's definitely a difficult one. Yes. Yeah. Okay, so Linda here has diminished monofilament scores, so she didn't feel anything on the plantar surface of her foot, but she did feel when I touched on her dorsal aspect of her foot. So she would have abnormal monofilament findings. And next, I'm going to have her stand up, and I'm just going to assess her balance. Move back a little bit. So I want you to put your feet together, and I want you to put your hands on your hips and close your eyes.
Oh gosh.
And I'll be right here guarding you.
It's a lot harder. You can
So someone with diabetic neuropathy will present with decreased balance, and that's about it. So, Linda, what I seem to have found from your subjective and objective examination is that you have diabetic neuropathy, specifically diabetic peripheral neuropathy, and I can fortunately treat your balance impairments and help you with a home exercise program just to keep you active and everything. But in regards to management of the disease, I'm going to have you see your endocrinologist and refer you back to him just so he can help you manage this new symptom onset. And I also can provide you with education about like baby feet checks and just how to prevent the progression of the disease.
I was always worried this would happen.
So for typical objective examination of someone with early stages of diabetic neuropathy, you'll see a positive monofilament test. So certain areas will be diminished in sensation, others might be normal. It just depends on the individual and their progression of the peripheral neuropathy. You'll see a decreased or absent Achilles tendon reflex, decreased distal sensation, which you saw during the dermatonal assessment. The patient might present with impaired balance, and they will also have abnormal neuropathy disability score findings. And the key diagnostic findings are abnormal nerve conduction studies. The NCS is the gold standard. However, we don't have access to this in physical therapy, as well as the neuropathy disability score, which treats early diabetic peripheral neuropathy. You will treat and refer to the endocrinologist. So, as the physical therapist, you will treat any balance or gait impairments, provide a home exercise program to help maintain an active lifestyle to manage high glucose levels, provide education on importance of diet and exercise, daily feet checks to prevent ulcers and further issues, but then ultimately refer to the endocrinologist for disease management to prevent the progression and control of complications.